Today, I'm going to talk about mental health status of ethnic minority under COVID-19 in Hong Kong. And once we want to talk more about it, I would like to bring your attention to the mental health of migrants who are living here in Hong Kong. And actually, this slide indicates more of the migrants all over the world. Migrants are the people who migrated or moved from their original country to a different country for living. So during this pandemic, their situation became worse. And according to IOM, migrants are particularly vulnerable to the direct and indirect effects of COVID-19. And they were often excluded from the host country welfare systems. In many European countries, in UK, Germany, it happened that people had no access to healthcare system because they did not have that kind of permission to access the healthcare system, and COVID made the things worse. Or they didn't have the visa status, that valid visa status, or there are many other things because pandemics suddenly came and people were in different stages of their immigration or migration stages, and they faced a lot of problems. Then greatly affected by border closures. Borders were closed for a long period of time. Because of that, people get not travel to their home countries. Then there were xenophobic and discriminatory attitudes were there. For Asian, we can see in many Western countries, Asian people had to face a lot of problems. Even in Asia, there are many other people, like all over the world, you can see that this kind of tendency that you bring this virus or that person bring that virus, those kind of attitudes came in the front. Then there are barriers in accessing healthcare services as well as information. That was also a problem. And then because of the unemployment or the job loss, the risk of falling into poverty for migrants increased a lot. Let's see the mental health status of ethnic minorities in Hong Kong. We did not have much statistics about specific mental health of a minority, but whatever we could get from the some recent research, we found that one thing, that there is an urgent need for mental health support for EM community. Second, it has been estimated that approximately 44,000 ethnic minority are suffering from mental health issues. And a survey conducted by MSF and Uplifters, an NGO, they showed that 72% of the foreign domestic helpers, they are having depression-related symptoms. So this does not show a comprehensive picture of the statistics of mental health status, but it definitely shows that there is a definite need of the mental health care support. People are suffering. And there are some news articles which I tried to copy paste here and try to see that there are many challenges related to mental health came up after this pandemic, related to their job, related to their education, employment, and their social issues all came up. So if you just want to summarize the stressors for ethnic minority living in Hong Kong, we can find these. I summarized in this bubbles, and the main stressors for ethnic minority for their mental health conditions or the status influencers are poverty, because many were working in a either in aviation sector or restaurant or like hospitality sector, and those jobs were suddenly lost, and because of that they fall into the poverty trap. Then social and prejudice and biases were there, employment conditions, access to information in their language or culturally sensitive material which they could understand in timely manner was missing. Family and relationship, some people like people lost their family member or trapped or stuck in their home country or any other country, so that all. And then there were work from home, study from home, those kind of issue in a small house or the apartment, that also created a lot of clashes within the family member. Education was a problem because many ethnic minority families did not afford to have devices for their children to have online classes. then access to healthcare was always an issue for the when it comes to the mental health care, because of a big stigma, language, and there are many other ethnocultural factors as well as system related factors that became source of stress for them. One more segment of people which I would like to mention here, which comes under the minority group also, and they are foreign domestic workers. So we have a big number, around 5% of minority population are made by foreign domestic workers from Philippines, from Indonesia, from Thailand, and different other countries. And what kind of challenges they faced, which impacted their mental health status, are, I tried to summarize in these bubbles, are working away from home because they had to leave their family members back home and come here. And the COVID was at both places. When it was, they become more stressed when they heard about the situation back home, and they need to be here alone, not able to go back and help their family. So that created a lot of mental trauma. Then employment condition and wages. That time a lot of policies came which made helpers not to go out, or there are a lot of discriminatory or the biased approach raised. Then because many employer lost their jobs, so wages was also disturbed, which again came the the impacted the frequency of financial remittances they could make, and also the remittance centers were closed for many days. Then paying the employment agency, they had to pay that their debt which they took to come here. That created a lot of mental stress. Not having a private room, because everyone in the small apartments, whole employer family was there, and they could not get any free time to relax, to any to do any of their activity, and that created their a lot of mental stress among them. Then age and duration of stay, that what is their age. And there are a lot of underreported physical abuse case happened during this period, and then discrimination was there. And then work related needs, and many other things. But I would like to mention here one thing, that I did a research on foreign domestic workers during this pandemic, and my research showed that foreign domestic workers were very unhappy with the government policies for them, that staying at home, or there are many other policies came up even for the quarantine process. Earlier they were supposed to do home quarantine, but there were no space for them to do that, or the money, who is going to pay, employers were not ready to pay. So there were many challenges came up. Then the border closure, not going back, or there are many challenges which impacted their mental health status.